Good afternoon. Thank you for joining this virtual presentation. My name is Labrini Nelligan, and I'm the Executive Director for London Deneen. I'm joined today by Denise O'Connell, Senior Program Manager for London Deneen. We're here to talk to you about one of our signature programs addressing an important public health issue, unhealthy alcohol use. The program is called Time to Ask, and the tagline for Time to Ask is Education Transforms Conversations About Alcohol Use. I'd like to begin by first thanking Becky Ireland, who serves on our Time to Ask statewide advisory team. Thank you, Becky, for inviting us to speak with all of you today. And to start our presentation, we would like to provide you with some background about our organization, London Deneen. London Deneen was established in 2011 when the Massachusetts General Hospital in Boston and the Lunder Foundation of Maine came together with a shared vision to identify and address gaps in continuing education. The Lunder family spent many years in Maine, and when in Boston had a very positive patient experience at Mass General, and they wanted to give back. And from there was born this shared vision and effort to create London Deneen. It was an ideal partnership as MGH is a major academic teaching hospital and has long-standing collaborations with its Maine neighbors. On this slide, you'll see the mission for our program. Give you a moment to read that. You'll see our funders, Mr. and Mrs. Peter Lunder, and of course the MGH logo as well. Currently, London Deneen has 3 signature educational programs that address public health issues or workforce issues in the state of Maine. Again, today we'll talk to you about one of those programs, Time to Ask. During this conversation, we'll cover the Time to Ask model and how you can help. We'll also answer the questions, why alcohol, why Maine, why primary care. The ultimate goal of the program is to empower healthcare teams to comfortably and confidently have conversations about unhealthy alcohol use with their patients, so patients have the information to make informed choices about their health as it relates to alcohol consumption. On this slide, you'll see our learning objectives for this session. Please take a moment to read those. I'm now going to turn it over to Denise O'Connell for the next section.
Thank you, Labrini. Hello, everyone. I'm delighted to be speaking with you. We hope that this conversation really sparks your interest and your wish to partner with us and share with us your expertise in prevention. Many of you know that alcohol is the #1 substance of misuse in Maine, and that ignoring this public health problem can lead to more costly care. Alcohol screening is the most effective strategy to address unhealthy alcohol use, but our learning needs assessment revealed that most health professionals lack the knowledge, skills, and attitudes to provide regular and effective screening and monitoring of alcohol use within primary care practices. The Time to Ask program was designed and built to meet this identified education need. Alcohol problems affect us all. Preventing and identifying unhealthy alcohol use across the age continuum can intercept a potential health problem before it escalates, placing the person and wider community at risk and perhaps requiring costly and lengthy healthcare interventions. Please take a moment to think about the many life transitions and risks for each age group as it relates to alcohol consumption. What may come to mind is thinking about someone becoming a new parent, someone retiring, a marriage, a divorce. All of these can put stress on a person. We think this slide provides answers to these questions about this public health problem. Why alcohol and why primary care? Please take a moment to read them. Some of this data is included in our pre- and post-program impact evaluation reports, all of which can be found on our website. Several articles were recently published explaining why primary care is the ideal place to hold alcohol consumption conversations with patients. Primary care is where we've been implementing the Time to Ask program, with the goal being to equip and empower interprofessional teams to compassionately and effectively screen for unhealthy alcohol use so patients can make informed decisions. Intervening early, intervening often can prevent greater disease and alcohol use disorders. Since most of us, including health professionals, know very little about alcohol's impact on the body, we created this poster to be used in exam rooms and in waiting rooms. There are no healthy levels, but instead risk levels. This poster can be found on our website, and we're happy to provide you with copies. And at our last Time to Ask site, we had large posters branded with the organization's colors and logos made and hung in their waiting rooms. And we had complimentary posters made for each exam room, pocket guides for providers and patients, and even a video loop to play in waiting rooms. We'd like to give you a moment now to pause and consider the question on this slide. And when getting to know a practice, we often ask this question early on of them. Is there a return on investment when patients are screened for unhealthy alcohol use in the primary care setting? Now, let's consider for a moment the cost of doing nothing. If a patient's receiving treatment for a chronic medical condition such as hypertension, diabetes, congestive heart failure, and care providers suspect that the patient may be consuming alcohol at unhealthy levels, but don't address that through alcohol screening, might the effectiveness of the treatment be impacted? Does the patient with unhealthy alcohol use present more often to the practice or to the emergency room with symptoms associated with misuse? And what about accidents and lost work time and the justice system? What about the impact on the family members and the children? While our program teaches primary care providers to screen and identify unhealthy alcohol use, about 5% will present with an actual disorder. Alcohol use disorder is a chronic illness, it's a brain disease, and it may take 4 to 5 years for a person to seek treatment. And stigma may impact a person's decision to delay seeking that treatment. So it's really important to think about alcohol use disorder as a chronic disease and apply the chronic disease model of care to it. And that's what you see on this screen. And the Alcohol Use Disorders in Primary Care, What Do We Know and Where Do We Go article by Ream, they indicated delay in treatment can be changed at the primary care level simply by making treatment part of the disease management for comorbid conditions. We know that if alcohol is routinely addressed as part of managing other comorbid conditions such as hypertension, it may not only improve management of those conditions, but also reduce stigma. With education and training, support, and access to experts, we intend that primary care teams will be comfortable and confident in engaging in alcohol use conversations with patients. And we know this is effective in patients modifying their behavior. So I'm going to turn it back over to Labrini right now.
Thank you, Denise. Now on this slide, you see our Time to Ask logo and also our 10-year seal as London Deneen turned 10 this year. Okay, what can be done and how? These are the questions we asked ourselves as we started to develop the program. This slide depicts our framework for project development. So let's start far over to the left. We began by first assembling a team of stakeholders representing both practice and academia and also policy to help guide this work. We still meet with this statewide advisory team monthly, and we're very fortunate to have them at the helm of this work. We then selected pilot sites and conducted pre-program needs assessments to ensure our program would be data and stakeholder informed, and also learner informed, which is very important to us. We then set out to design and develop the program using both 21st century learning and teaching best practices, but also a unique three-pronged implementation approach, which we will share a little bit more about later on in this presentation, but we think that really sets us apart from other continuing education programs. We then went ahead and implemented the pilot project in several locations, evaluated both the education and the implementation process, and we are now focusing on expansion to provide the program to as many teams as possible across the state of Maine. Excellent. On this slide, you will see our guiding principles. I'll give you a moment to read those. Again, before we set out to do this work, we really combed the state and the nation to see what else was out there. And nothing really existed that hit on all of these guiding principles. We wanted an education and quality improvement program. We wanted the program to be interprofessional, blended learning, really focusing on those 21st century best learning practices for adult learners. And to set the program up for success, we determined that these were necessary to employ as part of our program development. So we created our own program, Time to Ask from Soup to Nuts. Denise will now examine each of these guiding principles.
Thank you, Labrini. So our program is both data and stakeholder informed. The education was developed using data from 3 primary care practices across the state to examine gaps and preferences in learning. What you see on the slide is a screenshot of our Phase 1 Impact Evaluation Report that revealed that learners across professions learned, they liked the content, they changed their practice, and had significant attitudinal shifts. And what that means is they now have a stronger belief that they can manage a person for the long term in their practice. Our program is interprofessional. So what is interprofessional team-based practice? Take a minute to read the definition on this slide and look at the team members, most often at a primary care practice and in particular federally qualified rural health centers. The team-based approach utilizes the expertise of every team member to address unhealthy alcohol use. And in doing so, it advances an efficient and effective process for alcohol screening as a primary care intervention. The Time to Ask program includes everyone on the team. They all participate. Our model includes 3 buckets: education and training in the first column, practice support, practice facilitation in the second column, and access to experts in the third column. Please take a moment to read this slide. What we know from the evidence is all 3 of these together lead to practice transformation. We provide 4 online learning modules that are available 24/7, and they're assigned based on someone's role at the practice. So for example, the front desk scheduler would take module 1, the clinical team would take all of the modules. We also provide a workshop on medication treatment, providing access to addiction experts. And the program also provides, over the course of about 6 months, in-person practice support so that we can coach the team to apply what they're learning. More information is on our website, but I thought you might be interested in the titles. So Module 1 is called Alcohol Use in Everyday Life. Module 2 is called The Art and Science of the Conversation. Module 3 is Addressing Unhealthy Alcohol Use and Alcohol Use Disorder in Primary Care, and that's available for 1 CME. The live CME workshop is called Medication Treatment for Alcohol Use Disorder, and we have a supplemental module for 1 CME called Motivational Interviewing. I'll turn it back over to Labrini.
Excellent. Thank you, Denise. When we work with a primary care practice site to implement that 3-pronged implementation strategy, we're usually with them from about 4 to 6 months, and we can share more information about that process with you. But to date, I love this slide because it shows the footprint of where we've been. We've been to 8 primary care practices across the state of Maine. From those 8, we've had a total of 375 learners who care for over 33,000 patients. So during our time with each of these practice sites, we've led 8 expert faculty workshops on medication treatment, and we've had also close to 50 in-person consultation meetings. All but one of these practices is an FQHC. Our next location, which we're very excited about, is a multi-site system called Greater Portland Health. We anticipate some tailoring and evolving of the program as we embark on our first urban location serving a very diverse population. Here's some happy time to ask committee members from those various locations. We are very fortunate to have committed partners, and together we do the work, but as you can see here, we also have some fun. So here's how we think we might work with all of you. We understand from Becky that you have a charge to provide alcohol use disorder prevention information to your practice partners. You know your practice partners best, and if you think that any might be interested in the Time to Ask program, we hope that you can share this information with them. We are prepared to support you by providing access to you of our modules, our manual, our workshop, collaterals, everything you saw today so you can confidently speak about this program. We're also happy to send you hard copies of any of the materials or collaterals that you saw as well. And if one of your primary care partners identifies interest in the program, we are happy to take you and them through this presentation again and talk a little bit further about what the implementation and timeline and partnering looks like. Because of your expertise in prevention, after you review any of these materials, we would also really welcome your feedback on additional prevention components, collaterals, anything else you think that would strengthen this work. For additional information on Time to Ask and to see some of those collaterals and videos and to download some of the resources, please visit our website, lunderdeneen.org. You'll see a drop down for our programs and you'll see Time to Ask listed there. As a part 2 to this video introduction, we will be hosting a Q&A over Zoom next month. Please stay tuned for the date and time of that Zoom meeting. And again, we invite you to join us so we can meet you and provide additional information and answer any outstanding questions that you may have. Thank you again for your time today. Thank you for joining us, and we look forward to meeting all of you next month.
Thank you.